Hi, this is Dr. Duresti with the Cranial Release Technique, back at you with another video. I was reviewing the online training course that we produced a few years back, and there's a section about pre and post testing with a client. So this is sort of geared more towards practitioners, but the lay people would understand this as well. How do you know as a practitioner that you achieved what you thought you were going to achieve? Well, the way I always was taught and the way that I teach it in the cranial release technique is that you do some sort of test before. For example, you check someone's leg and you see one leg is short, maybe you turn the legs in, maybe one leg is tighter. Then you apply the technique. In my case, you apply the cranial release. You go back and I'm looking for improvement. I'm looking for the shorter leg to be more balanced. I'm looking for the muscular tension to be more balanced. When I see that, I know that I'm done for that day with that patient. And I know there are many different techniques out there in chiropractic, in the different therapies, in acupuncture, in oriental medicine, in naturopathy. Whatever it is that you do, my point is that I think it makes sense to do something before you do your adjustment, your needling, your therapy, whatever it is, and then to recheck after to make sure that something has changed in a positive state. And when that does change, in my book, I'm done with cranial release. And then I'll tell the patient, I'll see you back on the next visit, whenever that happens to be, depending on what their schedule is, which is based on how their body responds to stress. That's the indicators that I look at. Because remember, and in the training we go into this in much more detail, the brain is made of two hemispheres. And when those hemispheres are balanced, communication is balanced between brain hemispheres, communication is balanced between brain and body. In theory, legs would be balanced, hips would be balanced, shoulders would be balanced. When the patient comes in, high shoulder, high hip, short leg, that's an indication for me that one of the hemispheres is overactive because of stress. Based on that neurology, I then go and check the patient's muscular tension, short leg, high hip, high shoulder, other things that we look at as well. Apply the cranial release, go back and recheck, and if I see improvement, again, I'm finished for that day with that patient. And then I want them to go back into the real world, back into the stresses of life, the physical, the chemical, the emotional stresses, and see how long their nervous system can hold in that balanced pattern until there's a bit of a short circuit. And for some people that could be a week. For some people, that could be a month. Depending on your level of stress and how you handle stress, that could be a few days. So that's how I always determine how often to work on a patient, how often to have a patient come back in. And again, the beauty is with cranial release, you really can't overdo it. In theory, I could see you daily for the rest of your life to keep you balanced and just keep enhancing the cranial function, enhance the central nervous system function so that you can be the best that you were designed to be. This is Dr. Duresti with the Cranial Release Technique. Thank you so much for watching this short video. Again, the website cranialrelease.com for those of you that are looking for a practitioner or those of you that are looking maybe to learn the cranial release technique in the comfort of your home or office. There's a button there that says Online Training Program. You just click that button, get the information, register for the training, and you get all the details, everything that I told you about just now, everything there is to know about the technique, how to apply it, how to explain it, how to determine when the patient needs it. Thanks so much for watching. Have a fabulous day. Dr. Duresti signing off. Adios, my friends. See you soon. Goodbye.